parts so we get it as right as possible. I'll be calling up the members 8 at a time. I've been patient this entire meeting, and I ask for reciprocal patience here. If you just walked in, you may need to wait for a third panel. And for those listening who aren't here, you may need to wait for a fourth panel, and so on. Again, I'm asking everyone to be patient. We'll be identifying the members for each panel verbally. I believe if you are on the Democrat side, and I think everyone who wants to offer an amendment is on the Democrat side, you may talk to the Democrat staff outside about where you might be in the queue.
Could the leader just address Connelly first and not compare his 5 minutes? Absolutely. So let's start with it and then do
Mr. Jeffries, I understand you want to address the group in terms of the loss of Mr. Connelly first, and then I'll identify you for your testimony.
Well, Madam Chair, thank you so much, and thank you so much for the moment of silence and the kind words of remembrance on behalf of our dear colleague, Jerry Connelly, who really was a member's member, someone who conducted himself with the highest degree of intellect, brilliance, resilience, integrity, humor, and wit. It's a great loss for his family, great loss for his district, great loss for the Commonwealth of Virginia, great loss for us as House Democrats, but certainly a great loss for the Congress and for the country, given just the depth of his representation, the relationships that he had on both sides of the aisle, on both sides of the Capitol, and the fierce representation that he provided to the people that he's been privileged to represent for decades. Thank you for giving me the opportunity to share some brief words of reflection on behalf of the House Democratic Caucus.
Well, I'm reminded of an old poem, "For Whom the Bell Tolls."
Thank you, Madam Chair.
Thank you, Mr. Jeffries. Now, I'd like to recognize that we have Minority Leader Jeffries, Leader Clark, and part of the leadership, Mr. Aguilar, at the witness table for our first panel. So I now will recognize each of you. Will you be going first, Mr. Jeffries?
Thank you, Madam Chair. Good morning. Thank you, Chairwoman Fox and Ranking Member McGovern, for the opportunity to testify at this incredibly important Rules Committee meeting. I also thank my colleagues, Whip Catherine Clark and Caucus Chair Pete Aguilar, for partnering with me on this amendment. Come before you today with an amendment to strike the unacceptable, unconscionable, and un-American cuts to the health care and food assistance of the American people. America is the wealthiest country in the history of the world. We are better than this. The great American middle-class dream is that when you work hard and play by the rules, you should have the ability to provide a comfortable life for yourself and for your family, a good paying job, educate your children, purchase a home, and have access to high quality and affordable health care, as well as be able to put food on your kitchen or dining room table. Unfortunately, we are here today discussing a bill that would make that American dream harder to reach for millions by increasing costs for families, hardworking American families, and gutting the things that they need to survive and thrive. This reckless budget would take health care and food assistance away from millions of people in order to provide tax cuts to the wealthy, the well-off, and the well-connected. It would hurt children, hurt seniors, hurt families, hurt women, hurt people with disabilities, and hurt our nation's veterans. If enacted, the GOP tax scam would represent the largest cut to health care in American history and the largest cut to nutritional assistance in American history in order to provide the largest tax breaks to billionaires like Elon Musk in American history. So let's begin with the health care component of this amendment. Everyone should have access to high quality and affordable health care in the United States of America. In 1965, Congress created both Medicare and Medicaid. In the intervening decades, Congress passed legislation to expand and strengthen these important programs. In 2010, this Congress, under the leadership of Speaker Nancy D'Alessandro Pelosi, passed the historic Affordable Care Act, which created new protections for people with pre-existing conditions and expanded health care for tens of millions of people who couldn't otherwise afford it. Since then, we have managed to achieve the lowest uninsured rate in history. Why would we go backward? Which is what the GOP tax scam would do. We know, however, that our healthcare system is not perfect. Too many Americans continue to be unable to pay their medical bills and struggle to get access to the care that they need. As Democrats, we are ready to work in a bipartisan manner to address these challenges, but we will never support any Republican effort to rip away health care from the American people. This GOP tax scam will force nearly 14 million people to lose their health coverage and cause millions more to pay higher copays, premiums, and deductibles. Hospitals will close, nursing homes will shut down, and people will die in all of your districts. Now, prior to the modern SNAP program being created in 1964, there was vast hunger and food insecurity across this country, including in low-income communities, rural areas, and communities of color. Thanks to public investigations, community-based organizations, and some good journalism, these challenges were spotlighted, and the need for an expansion of federal food assistance was highlighted. The American people were moved by images of children with distended bellies rummaging around in garbage and families going hungry. It finally compelled Congress to act. And over the last 60 years, we as a country have made significant progress to reduce hunger and help people afford nutritional food. Unfortunately, the policies in this GOP tax scam threaten to undo this progress and return us to an age where far too many children or veterans or seniors are struggling to eat and get access to the nutrition that they need. It's also important to recognize that SNAP is a vital part of providing opportunity for our farmers, who we stand with, food makers, small businesses, truckers, independent grocers, and the entire supply chain. So for the Republicans who have promised to love and cherish Medicaid, I ask you to support this amendment. For the Republicans who believe we should not rip food away from the mouths of children, seniors, and veterans, we ask you to support this amendment. And for the Republicans who believe that the gospel in Matthew 25 and 35 teaches us to stand up for the poor, the sick, the afflicted, the least, the lost, and the left behind, we ask you to support this amendment and strike these harmful cuts to health care and nutritional assistance. Thank you, Madam Chair. I yield back.
Thank you, Madam Chair, and the Ranking Member McGovern, the members of this committee. I am a proud co-sponsor of Leader Jeffrey's amendment, Protecting Medicaid and SNAP. And my Democratic colleagues have done an excellent job laying out how taking Medicaid and food from kids and seniors and veterans and moms to give tax cuts to billionaires while increasing increasing our deficit is a triple threat to the American people. But unfortunately, it doesn't end there. I'm offering an additional amendment that strikes a provision that would defund Planned Parenthood. Speaker Johnson recently said about this provision, it is about going after, quote, big abortion. But he knows better than that. We all know the federal government doesn't pay for abortion care. We all know Republicans have already decimated access to safe abortions in this country. So what does this provision actually do? It further defunds women's health care. It defunds cancer screenings, prenatal care, postpartum services, fertility treatments, preventative care. 96% of Planned Parenthood's clinical work has nothing to do with abortion, but everything to do with serving millions of women, most of them overwhelmingly in rural and underserved areas, who are having a hard time finding reproductive care or any health care, especially in states with abortion bans. Faced with the choice of either breaking the law or breaking their oath to put patients first, OBGYNs are packing up and leaving. As a result, 35% of counties in America don't have a single obstetrician. In Georgia, it's 42%. In Texas, it's 50%. Clinics are shutting down while maternal mortality is on the rise. Infant mortality is up for the first time in decades. How does this bill respond to this Republican-manufactured crisis? It piles on. It makes it even harder for women to find health care. Without this amendment, it would shut down nearly 600 health centers run by Planned Parenthood, 64% of which serve women living in medical deserts. These are communities that don't have enough health care providers as it is. These are women who overwhelmingly live in rural areas. These are women that you represent. If Planned Parenthood is defunded, 7,500 South Carolinians will lose their doctor. All of them, 100%, live in a medical desert. 9,200 Georgians are on the edge of that same cliff, 75% in medical deserts. 22,000 Hoosiers, 82% medical deserts. 24,000 Virginians, 50%. 37,000 North Carolinians, 67%. 51,000 Minnesotans, 69%, and 118,000 Texans. Count on Planned Parenthood in a state where babies and pregnant women are dying at a historic rate. 2/3 of Texans live in medical deserts, and 141,000 New Yorkers are about to see 47 clinics boarded up, 61% of them in the neediest areas in New York State. Millions of women are counting on their representatives to make the right decision. Women like Cheryl from North Carolina, who years ago was overdue for a pap smear, but she didn't have insurance and she kept putting it off. A friend mentioned Planned Parenthood would provide this free of charge. She booked an appointment, got checked, and it came back abnormal. They caught it early, and the cancer was removed. Cheryl credits Planned Parenthood with saving her life. A lot of stories begin like Cheryl's. They should all end in the same way, with health care that saves lives. I hope this amendment gives you all pause. When the women in this country deserve health care, and I hope you will think about the moms struggling to get by and stay healthy for the sake of their children and their families. It is not too late. Do right by them. Make this amendment in order for floor consideration. Thank you, Madam Chair.
Thank you. Mr. Aguilar.
Thank you, Madam Chair. Ranking Member McGovern, distinguished colleagues on the committee. I appreciate your kind words about our colleague, Mr. Connelly, as well, Madam Chair. I'm grateful for the opportunity to introduce amendments that would strengthen SNAP, a program that helps families across the country meet their basic needs. I'm also proud to co-sponsor Leader Jeffries' amendment. State governments can't afford to take on the extra costs that this legislation would impose on them. It would force leaders in red states and blue states to either raise taxes or remove people from SNAP, leaving even more Americans hungrier and poorer. I wish more Americans had the opportunity to hear from our prior panel's testimony during the workday, but this committee made the choice to hide from the public and keep hidden what's actually in this bill. In fact, we're still told that managers' amendments are still being negotiated and are incomplete. It is outrageous that this committee is debating these policies under the cover of darkness, but it shouldn't be surprising. Legislation you intend to pass, started at some ungodly hour, kicks millions of Americans off their health insurance and takes away food assistance for families who need it most. As grocery prices rise, I cannot understand why my Republican colleagues want to take food out of the mouths of mothers, children, and veterans while making health care even more expensive. House Democrats are eager to take on waste, fraud, and abuse throughout the federal government, but we cannot find a willing partner on the other side of the aisle because of our colleagues' single-minded focus on cutting health care for people who need it most. This legislation doesn't make Medicaid or SNAP more efficient or more fair, Madam Chair. All this bill does is ensure that billionaires who have never had to worry about a hospital bill or putting food on the table can continue to pay less in taxes than a teacher, a firefighter, or a nurse. Madam Chair, it is a fact that only House Democrats want to make health care more accessible and more affordable for everyone. We will continue to fight back against this effort to drive up costs of health insurance and end basic needs programs just to make a group of campaign donors happy. The contrast is clear. House Republicans are making health care more expensive and less accessible. House Democrats want to ensure that every American can earn the peace of mind of a good-paying job with great benefits. I yield back, Madam Chair.
Thank you. Mr. Aguilar, would you mind leaving your testimony with me, because I don't believe I heard a couple of things that you said, and I just want to look at it before I make any comments.
Of course.
Okay, I want to double check that I heard some things that I think you said.
Okay.
Before I make any comment.
Of course.
I'm going to recognize, before I speak, I'm going to recognize any of my colleagues. Ms. Houchin, Mr. Langworthy, Mr. Scott, you're recognized.
Madam Chair, I would just like to ask unanimous consent to submit for the record an article entitled Rich State Poor People. And if I might,
Without objection.
if I might just read from it, the oil and gas boom has helped New Mexico has become the nation's second biggest oil producing state. Taxes paid on the state's oil production will generate, and in quotations, more money than we know what to do with, according to Democrat State Senator and Legislative Finance Committee Chair George Munoz. States are flush with cash that are well run. Thank you.
Without objection. Mr. McGovern, you're recognized.
Yeah. First of all, let me just address something that Chairman Smith said. He went through all the things in the tax section of the reconciliation bill that, quite frankly, most of us support. I mean, the child tax credit, the no tax on tips, the middle-class tax cuts. But what he omitted was the tax cuts for billionaires. What he omitted were the cuts to Medicaid that will throw people off of health care, or the cuts to SNAP. Leader Jeffries, we're reasonable. We're happy to work with them. But there's no way in hell we're going to support a bill that's going to throw 14 million people off of health care, or throw millions of people off of SNAP. Maybe you can comment on how would children, how would seniors be impacted by the legislation that is before us?
Well, thank you, Mr. McGovern. You know, this legislation would rip health care away from approximately 14 million Americans, including millions of children who will be adversely impacted by the fact that Medicaid is being cut in the greatest numbers in American history, children who would otherwise be able to see a doctor when they're sick but might not be able to as a result of Medicaid being ripped away. Children who will no longer have the ability to receive preventative care that could catch things early enough to avoid serious illness or death. They're impacted by the GOP tax scam. Seniors, of course, who will have their Medicaid ripped away from them will also be adversely impacted because the majority of seniors who receive nursing home care in America or home care in America, these aren't statistics, it's our parents, our grandmother, our grandfather, our great-grandmother and grandfather. The majority of people who receive nursing home care in America or home care in America, which allows people to maintain dignity and respect in their amazing golden years, they rely on Medicaid to receive that assistance. And that, of course, is at risk of being ripped away from them. And Mr. McGovern, it's all being done in service of enacting the largest tax breaks for billionaires in American history. Billionaires like Elon Musk, who's the last person in this country who deserves a tax break.
And Ms. Aguilar, I support your amendment. You know, interesting enough, the House Agriculture Committee never did a hearing on the cost-sharing issue with states. And there's a reason why governors all over the country are panicking that they may be hit with a bill of hundreds of millions of dollars or even $1 billion in the case of Pennsylvania, which they're not going to be able to meet, and therefore it will result in them costing, it will end up cutting the benefit to people. And so I support it totally. And Leader Clark, let me ask you, is it possible at all for other providers like community health centers to absorb the patients that Planned Parenthood health centers see annually? And what services for women would be at risk?
Thank you so much for the question, and let's bust this myth once and for all, because we have two things going on here. We have the nearly 14 million Americans, including many women, seniors, moms, pregnant moms, who are going to be have their health care taken away from them totally, and that impacts health care centers, FQHCs. They receive, Medicaid is the single largest source of payments, reimbursements for our FQHCs. And this is what's always pointed to by the right, as they will just pick up these services for women out of this defunded clinics for Planned Parenthood. It is impossible. At the same time that you are cutting Medicaid to these clinics, in Massachusetts alone, that'll be a almost $1.2 billion cut to these health centers, and saying if you're going to pick up what Planned Parenthood provides, you would have to increase the capacity of our FQHCs by 56%. So we're going to take away Medicaid over here, and then we're going to say magically increase capacity by 56%. To serve the women who will no longer have a place to get the cancer screenings, the prenatal care, the fertility treatments, contraception, reproductive health care that they need, and that is increasingly difficult to find.
Yeah. I regret that so much of what is done in this Congress and in this current administration around health care is so politically charged.
Yeah.
And again, going back to the SNAP issue, people are going to see their benefits cut. Again, on average of $2 a person, per meal. That's it. And if states can't meet their cost share, they have no choice but to cut the benefit. And no hearings on this, not one single hearing. And this is a major change, and not even the courtesy of a hearing. We weren't able to bring in governors or anybody from any states to be able to comment on what the impact of this would be, or whether even all the states could meet, their financial obligation. And I mean, that it's part of a reconciliation bill, and that nobody even cares enough to do a hearing on it. Is that the way you legislate around here? I don't know if you want to add anything before I yield back.
Thank you, Mr. McGovern. I think that's incredibly important, and I just share that the cost share discussion really breaks a promise of 50 years of a relationship between the federal government and the states. This is shifting more resources so they can be the bad guys, and so they can reduce benefits, kick people off of eligibility. It's just an existential threat and would result in significant reductions in benefits to the people who need it most.
And I'll just say finally, all this does is it gives my Republican friends some cover to be able to dodge responsibility, and when benefits get cut, say, hey, it's not me, it's the states. And again, that to me is very cynical. I yield back my time.
Thank you, Mr. McGovern. Ms. Fishbach. Thank you. Ms. Scanlon, you're recognized.
Thank you. I think we just heard a little bit about myth busting. So, Leader Jeffries, I was wondering if you could address the myth which we have had thrown at us repeatedly throughout all the committee hearings on this bill, that somehow these proposals are going to be paid for by kicking undocumented immigrants off federally subsidized food and health care. Is that true? Are undocumented immigrants getting federal health care and federal food benefits?
Yeah, it's a great question. Under current law, undocumented immigrants are already ineligible for Medicaid, the ACA exchanges, and for SNAP benefits. Not a single undocumented immigrant in this country gets a dime in federal taxpayer dollars for any part of comprehensive Medicaid coverage. Not one. And so when we're talking about nearly 14 million people who are going to be thrown off their health insurance, millions of others who are going to be jammed up by this aggressive cut to SNAP, the largest cut to food assistance in American history, we're talking about American children. We're talking about everyday Americans. We're talking about Americans with disabilities. And when it comes to nutritional assistance, we're talking about veterans who have served this country, sacrificed, risked it all. And they're going to lose access to the food assistance they need to live a life of dignity and respect. Those are the facts. That's why we're fighting hard to stop this GOP tax scam that will hurt everyday Americans dead in its tracks.
I appreciate that, because we've heard this gaslighting, for weeks now, and we knew it wasn't true, but I appreciate your clarifying that as well. And of course, to the extent that anyone was trying to game the system and get benefits to which they were not entitled, we have inspectors general who were tasked with rooting out fraud, waste, and abuse, but unfortunately have been fired by this administration. So, don't preach about wanting to ferret out fraud, waste, and abuse when you're pulling the watchdogs whose job it was. Thank you. I yield back.
Thank you, Mr. Scott. I've already came to you. Mr. Neguse, you're recognized.
Thank you. Thank you, Madam Chair. Thank you, Leader Jeffries, Whip Clark, and Chairman Aguilar for your leadership and for the amendments that you've submitted before the committee today. As you all know, we started at 1 a.m., so this hearing's been going now for about 10 hours. We've heard from many Republican chairmen. We have, of course, many members of our caucus who are here that we'll hear from. The only person, and of course we have all the leadership of the House Democratic Caucus, and we're so grateful that each of you came forward to testify in this fashion. The one person we haven't heard from is the Speaker, who came here briefly earlier but was not willing, I guess, to testify in the way that you all have. Mr. Leader, I know you offered to debate the Speaker on the floor. I believe sent a letter to him about a month and a half ago on this particular reconciliation bill. And I wonder if you might expound a bit on why you think that is important for the American people to be able to hear that debate and that dialogue.
Well, I thank the distinguished gentleman from the great state of Colorado. And first of all, let me thank all of the members of the Rules Committee, certainly my colleagues on the Democratic side who have done a tremendous job on behalf of the American people, Jim McGovern, Mary Gay Scanlon, you, Joe Neguse, and of course, Teresa Leger Fernandez. Let me also thank the chair, Chairwoman Fox, from the great state of North Carolina by way of New York City. She may have left the Bronx, but the boogie down Bronx has never left her. So thank you for providing this opportunity for us to have this discussion. But one person is missing, Speaker Mike Johnson. Over a month ago, I asked our distinguished colleague from Louisiana, the Speaker of the House, to debate any of us, but certainly myself, on the House floor about this very bill. He believes it's one big, beautiful bill. We believe it's one big, ugly bill. That's going to hurt the American people, hurt children, hurt families, hurt veterans, hurt seniors, cut health care, cut nutritional assistance, explode the debt by a minimum of $3.8 trillion. This is being done by people who claim to be the stewards of fiscal responsibility. $3.8 trillion, if not more. And so the offer still stands. I'd love to have the opportunity to debate Speaker Johnson anytime, any place, right here at the Rules Committee, or certainly on the floor of the House of Representatives. Not a duel, a debate of ideas.
I couldn't agree more, and I thank the leader, the whip, the chairman, and I yield back the balance of my time.
Thank you, Mr. Neguse. Ms. Leger Fernandez, you're recognized.
Thank you, Madam Chair, and thank you to each of you for coming and testifying. Rep. Clark, as you described the impact that the abortion bans have had on states across this country, the lack of reproductive health care in states around this country, and then that this bill would then add to that difficulty. I am reminded, and I've been sharing lately, a story that I didn't used to talk about because it was so hard, about how when I was pregnant, I almost bled to death. And I remember lying on that hospital surgery piece of metal. And they didn't put me to sleep because we were trying to save the baby. And they were screaming, we're going to lose her, we're going to lose her, we're going to lose her. Those doctors could concentrate on saving my life. They did not have to worry about whether they were going to be criminally charged or whether they were going to have to shut down their practice because they were working on a complicated pregnancy. And now we know across the country, in rural areas especially, we are losing our OBGYN care. So I want you to talk a little bit more about what happens in those rural areas, what happens in those areas where doctors are fleeing, and how what they're doing in this bill by going after Planned Parenthood, does that make it worse
Thank you. Thank you for sharing that story. And it is the story of women across this country. Pregnancy is often complicated and it needs interventions. And we want safe outcomes. The way we get that is good prenatal care and being able to find that within a 50-mile drive from your home. And with the abortion bans, that is becoming out of reach for so many people. And it compounds the cruelty in this bill that is already there in all that they are taking away from women and children and families, from their health care, from food programs, public schools, the list goes on, for this cynical exercise of giving tax cuts to people who are too wealthy to need them or maybe even notice them. So we have to keep our eye focused on what is happening. And with this amendment, it may seem like a sort of insignificant or a very detailed part of this overall package, but the themes are the same. And at the end of the day, it is denial of health care for women in this country. And at the same time, we have a White House lamenting, why aren't women having children? Maybe we'll give them $5,000. If you don't have a safe place to have a child, if you cannot guarantee that you will survive, have the medical attention that you will need, and if you're able to have that child, that child will be able to access health care, that you'll be able to find affordable quality child care near where you go to work, that you will be able to have the fundamentals of a housing to be able to put a life together. A recent study showed the majority of families in this country, 60% of families, cannot afford the basics. And what they're saying in this, and what makes it so pernicious, is this has no place in a reconciliation bill. This is ideology. And this is policy. And this is saying we don't like abortion providers, and it's not enough to outlaw them in our own states, to deny that care in those states. If there is an affiliate or a subsidiary in any state, then we will shut down the clinic that is not providing abortion care, but is providing this critical primary care for women. That doesn't belong in this bill either, and it is part of the pattern and the theme of this bill, that the American family is put last, and we are making the winner's circle so very small, and it doesn't include women in this country, it doesn't include working families, it doesn't include seniors and veterans, and the 99.9% of people who get up and work hard every single day and want to have a future for their children, a place in this economy, want their small business to survive this tariff regime, want to be able to put a life together that has hope. And instead, we're offering them ideology wrapped up as health care. It is a cruelty and it is a shame. And that is why we have seen the Democratic caucus and the American people united against this bill.
Thank you, Whip Clark. Chairman Aguilar, your amendment, I think, touches on a very important fact, and that is that people are working, and they're working really hard, and they're often not getting paid enough. And when Democrats were in charge, we increased jobs, but right now, there is a recession looming. And what they're going to do is kick people out of Medicaid, and they're not going to be able to get nutrition programs. And they're saying it's because people are lazy. Is that right, Chairman Aguilar? I mean, what is really happening with regards to American families who are working hard and just maybe not making enough money to afford health care?
Thank you, Congresswoman, for sharing your story, first of all, and for the question. My amendment prevents what I hope is something we can all agree on. No child in our country should go hungry. Yet under this bill, nearly 645,000 people, including children ages 7 to 18, will lose some or all of their SNAP benefit just in my state of California. Whether you're a child in New Mexico or Maine or California, that isn't right. As cruel and failed as that 3-month time limit is, it has never been applied to parents and grandparents with dependent children. It's right in the name, able-bodied adults without dependents. So what is supposed to happen, the child turns 7 and now doesn't need to go to school by themselves? It's just playing wrong, and it puts kids at risk. No one is staying home for SNAP benefits that are $6 per person per day. If my colleagues were serious, we wouldn't be providing child care and transportation and fair wages to help families make ends meet rather than cutting these important benefits.
Thank you, Chair Aguilar. And Leader Jeffries, thank you for painting the picture of what hunger looked like in America and what poverty looked like in America when we decided that that was not an acceptable picture for us. And I think it's a policy choice, but I think you also touched on a sense that it's also a moral choice. And I entered into the record earlier today a letter from 31 faith organizations who were opposing these kinds of cuts because they noted that it was against a principle, a moral principle, that government should provide for those who are in need. And I just wanted to give you the last word. I'm the last Democrat who gets to ask a question on these issues of how you see the values and the choices that are being made in this bill.
Well, thank you again for sharing your powerful story in such a compelling way, and it really does illustrate the challenges that we confront here. When we make policy decisions, we are impacting the American people in ways that in certain cases could be questions of life and death. It's often been said, Dr. King made this observation, that budgets are moral documents. And I don't question anyone's faith in this room. There are people of faith on both sides of the aisle. But we do have to ask the question, can't simply be enough to go to synagogue or go to the mosque or go to church and pray on Sunday and then come to Washington, D.C. and pray on the American people the rest of the week? P-R-E-Y. Pray on the poor, pray on the sick, pray on the afflicted, pray on working families, pray on everyday Americans, pray on our children, pray on our veterans, pray on older Americans. It can't be sufficient to go to church and pray on Sunday, but then come to Washington, D.C., advance a bill like the GOP tax scam, and pray on the American people for the rest of the week. Democrats will never stand for it, and we're going to fight hard to make sure that we do everything we can to uplift the American people, to protect their health care, protect nutritional assistance, protect our veterans, protect our children, protect our women, our families, older Americans, and to protect the American way of life. I yield back.
Thank you, Leader. Thank you, Rep. Clark. Thank you, Chair Aguilar. I will say that, as we did the procession on Palm Sunday, our Archbishop said exactly that he wanted to pray for all of us, that we would remember the poor and the needy, and that we would have the grace in our hearts to do what's right. Tribal leaders came and met with me yesterday and said that they had done the blessings in the morning so that they could bring them to Washington, D.C., because the cuts to Medicaid, the cuts to tribal sovereignty, the cuts was something their people could not survive. And so I think those prayers and those blessings are important so that when we come to Washington, we act from our hearts and that we let that lead our decisions. Thank you very much for all three of you for this incredible amendments, this incredible testimony. And with that, Madam Chair, I yield back.
Thank you, Ms. Leisure-Fernandez. Mr. Griffith, do you have any questions?
I do not. Thank you.
Thank you. Thank you all for coming. The witnesses are excused.
Thank you.
The list of the next page.
Hey, Madam Chair?
Yeah.
Yeah, while,
I'm going to announce the names.
yeah, but before you do, can I make one statement? Please. I want to thank all my colleagues who have been here for an incredibly long time. Some of them have been here since 1 o'clock in the morning. And I feel very proud to be part of this caucus, and I feel very proud of all the members who are here who want to make their voices and their views heard. And I especially want to also thank Speaker Emerita Nancy Pelosi for being here for hours as well. And I want to thank our leadership team. But it means a lot to me personally, and I think to everybody on this committee, that we have so many colleagues that feel so strongly that they have waited for hours and hours and hours to be able to present their amendments. And I thank you, Madam Chair, for letting me say that.
Okay, the next panel